what we can do.
Good morning. This is Dr. Doreste with the Cranial Release Technique. And we're here with a special guest, Mr. Knovy Nicolas. And Knovy, that you go by Knovy. I think that's not your real first name, right? Or
yes.
Is it? It is. So Knovy is a massage therapist in Queens, New York, in the area between Sunnyside and Woodside, for those of you that know Queens at all. And Knovy, you don't know this, but I was born and raised in Sunnyside. So you probably were not aware of that till I was about 6, 7 years old. Then we moved to a different part of Queens. So, but I wanted to speak to Knovy today because, first of all, Knovy is a massage therapist who uses cranial release in conjunction with massage. And he has some very interesting insights on what he's doing. And I thought this would help for our practitioners that are out there or other body workers that are thinking of learning the cranial release technique. So first of all, good morning, Knovy. Thanks for joining us.
Thank you for having me.
You're welcome. You're welcome. So we were just talking before while we were waiting for Zoom to update with us here. Knovy, you're originally from the Philippines.
I do.
You came to the U.S. at about 20, 21 years old, I think you said?
A little bit older than that, yes.
A little bit older than that, okay. Yeah. And you're in Queens, and when we were talking about this, so somebody comes in to see you on the first visit, you do your initial intake, you question why you're here, what's troubling you, all the questions that we go through. Then you do a few CRT type tests, you apply the technique, you then recheck them, and then you typically go right into the massage. Is that how it normally works?
Typically, yes. On the initial visit, I always conduct that, making sure they know I'm explaining to them what I'm doing.
Right.
So that they expect, because CRT, it just takes a few seconds.
Yes.
So I don't want them to like, what the hell, this guy is like wasting time with me. It's like, I want to go do massage immediately. Like that. Some of the clients are like, they're impatient because they're so stressed. They want the massage immediately.
Right.
So I guess to make it more, I want to make it very professional.
Sure.
I will present it that way. So I conduct and explain to them what I'm doing to make sure that they are aware that I'm not wasting their time. So by conducting that test before and after, I let them feel what the result of the technique that I done.
And normally, one of the tests you were mentioning that you like is what we call the push test, correct?
That's correct, yeah, because that's the easiest way for them to see the difference, that they know they're really off, and they're unaware of it.
Right. And for those people who don't know what we're talking about with this thing called the push test, it's a fabulous little test where you just take a piece of paper, have them stand with their feet on the edges of the paper, for example, and very gently you'd press on one pelvis, have them resist, press on the other pelvis. And what you'll normally find is that the patient will fall much more easily or have less resistance. It'll be much easier to push the patient over one side versus the other. And that tells us that in space, wherever the patient's head is it shifted more to the left or shifted to the right? Whichever side the head is shifted to, that's the side that the patient's going to fall to. And then after the cranial release technique, you notice that changes, Knovy, and they're aware that it changes?
Yeah, they can feel it. It's not,
feel it.
Not that I'm just telling them, oh, you're in center. No, they tell me.
Right.
And then some of them are like so surprised. Is that magic?
Right.
So I said, no, it's science.
There you go. There you go. I just did a video not too long ago, and I was talking about what's the relationship between cranial release technique and the lower extremity problem. So a leg problem, a hip problem, a knee problem, an ankle, a foot problem. And I was explaining to them that if you took 2 bathroom scales, an old trick that chiropractors always did, the old timers, they would take 2 bathroom scales, put them together, have the patient put the left foot on the left scale, the right foot on the right scale, and look at the difference in the weight. And it should be 0 to 3 pound difference. Most of the times it's like 10, 15, 20 pound difference. So they're carrying much more weight on one side, and after you do the cranial release, that comes back to normal. So the same concept with this push test that you're talking about. And again, if the head is off to the side, they're carrying more weight down that leg and they're putting more stress on that leg. So if they're doing 10,000 steps a day, that one leg is carrying a lot more steps 10,000 times than the other. So beautiful. So now you do something very unique also, because now you do your initial test. Is it just the push, or do you do other tests as well?
Depends. Most of the time it's only the push.
Push test. Okay.
Yeah, most of the time. Yeah.
When you got a good one, that's all you need, right?
Oh yeah. Once they felt I don't want to waste their time. They want to get onto the table. That's it.
Great.
Yeah.
All right. So then the patient, all right, so you do the push test, you do the cranial release, you repeat the test.
Yeah.
They feel a difference, they see a difference, they notice a difference. Now they get on the table, and now we're ready to start the massage. Is that
Yeah.
Do I have that right?
That's correct. Yeah.
Okay. Before we go into the next step, I'm just curious. As a male massage therapist, and my wife, as you know, is a massage therapist, I think the last time I read, and it was years ago, I would say what, 60, 70% of massage therapists would be female. Is that about right?
Yeah. Yes.
Maybe even more.
Maybe more. Yeah.
Maybe more.
Also, my
So,
clients are female.
As a male massage therapist, it's kind of a bit of a roadblock, because most people, when they think of massage therapist, they think of a woman and getting rubbed down and feeling better, obviously, when they're done. But with your practice, are your patients mostly male, female, 50-50? What's your experience with that?
Oh, most of my clients are female.
Most are female. Okay.
Yeah, most.
Okay.
Say 80%.
Yeah. Well, I think I would guess most patients that use our services, that's what I'll call alternative care, chiropractors, massage therapists, acupuncturists, the majority would be female, 35 to 55. Maybe it's even 60, 65 now. 35 years old to 55, 60, 65 years old. Those are the people who tend to take the best care of their body. So when something's not wrong, they go to try to find an answer. So, okay, great. So now the client, you did the CRT, now they get on the table. Are they starting face down, face up?
In my clinic, I start face up. Because I can, yeah.
And now you're doing what I guess I would call, I'm not a massage therapist, I guess what we would call a full body type massage?
Yes, I do.
Like a Swedish, I guess for lack of a better, Swedish massage, or you're doing sports massage, or you do it different for different clients?
My technique is a custom tailored massage. I mean, whatever I pick up from the assessment,
yes,
I conduct a different type. It's always a mixture of different modalities.
Okay. So the long and short of it, if someone comes in complaining of back and leg trouble and tightness, you're probably not going to start on the shoulder. That's what you're saying?
No, not really.
Not really.
I view the body as a garden.
As a garden.
As a garden. As
okay.
a different kind of it. That's how we view it.
Okay.
It always starts where it should, where in this way, in this case, related to CRTs, always starts from the top, from the brain, because that's where it gets its signals, it gets its communication.
Correct.
So I try to open up all the channels first from the top to the bottom. It doesn't matter where the issues is, on the legs, on the foot, on the toe. I open up there, because without communication with the brain, it's not gonna help that much if you go directly immediately where the issues are further away from the brain.
So you always start from the top down.
I will start from the top down. I may not be spending a lot there, but I try to open up as much as I can first, so that when I get to the point where I want to work on, it's a lot easier for those muscles and tendons and ligaments to respond.
Very good. Very good. Knovy, how long have you been a massage therapist for?
29 years.
29. Okay, so you've been around the block a few times, as we say, right?
Yeah, a little bit, yes.
And how long you been doing CRT? For like 6, 7 years now?
No, more than that. I got your certificate in 2013. I got it displayed here.
2013. All right, so 10
Yeah.
years coming up on.
Yep.
Very good. Tell us about your practice before CRT and the practice after learning CRT and using CRT. What's the difference? So if I'm a massage therapist sitting out there and I'm in Ohio or I'm in Italy or I'm in Australia and I'm listening to this and I'm saying, well, I'm a massage therapist. I work on clients, I work on athletes, I work on elderly, I work on kids. Why should I learn this thing called the cranial release technique? What can it help me do with my massage?
Oh, 100% it will totally change your whole entire view of massage. And totally, your client will actually treat you like a doctor. Well, I keep telling them I'm not a doctor. They're calling me like Dr. Knovy. I said that is not really the proper way. You know, it's not me. I'm not a doctor. I'm just trying to bring a good result. But definitely the result between I'm already like a how we call this, when I used to work in the spa, I'm one of the most requested therapists there. Not to brag, but I haven't learned the CRT yet at that time.
Right.
Learning the CRT doubled that. That's why it gave me the confidence to put my own practice, because I know whoever I see now, it's 99% that I got a retention back for the
It's
client.
99% that what?
Retention.
Retention. Okay.
Yeah.
Well, that's fabulous. You can't ask for better than that. So
No. I mean, I proved that. I kept like thinking every time I see, and sometimes I give just a sample, and that they definitely like say, "Oh, I'm gonna sign up immediately."
right.
Like
Right.
that.
Right.
Even
So any final words of wisdom if I were a massage therapist, a body worker out there anywhere in the world and I'm watching this, what would you tell that person about cranial release and should they want to learn the technique? Well, what would your advice be to them?
Well, I would say pursue this because this is a growing technique. This is something that you really want to have part of your toolbox, and actually a really good, a handy one, because you can use it in anywhere. You can and get a good result. Sometimes we ended it in a place where you're not sure what really this client is uh, experiencing, and at least the least you can provide them is to feel that change, to feel that balance in their system, and that would really help. It increases the body's healing, natural healing process.
Exactly.
That's the main idea there. So, I mean, I highly recommend it.
Well, thank you, Norman. Thank you. And you mentioned before that people call you doctor, and you remind them you're not a doctor. But it's funny. And I'm going to do another little chat about this in the near future. Remember, we all have the doctor inside. So all you're doing and all I'm doing is helping that doctor inside to do its work and heal the body from the inside out. That's really what it's all about.
Yeah.
Beautiful. I thought I had something else to ask you, Knovy, but I don't think I do. Any other things? Oh, when someone finishes on that first visit with you.
Yeah.
So now, thanks, Knovy. I feel great. Do you recommend when they should come back? Do you leave it up to them? How do you handle that?
Well, actually, before I recommend, they ask me, when do I come back?
Right.
So I tell them, I always respond I say, everybody's different. It really depends on how stressful between your environment, or what's your goal.
Right.
So many people have different goals, like because their environment is very stressful, their body's stressed a lot, or they want to meet their A game. Athletic people, I've seen so many marathoners, cyclists, CrossFit people, and they want to, and people who compete. So it really depends. I tell them, like, if you're have like a goal, then the more often the better you should come.
Right.
You know,
Okay.
it's up to them. I'm giving them all the decision.
You give them all.
I-
Okay.
I-
Very
yeah.
good. Okay. Novi, I think we covered everything. Anything else you want to say? You're located again in Woodside,
Sunnyside.
or Sunnyside, Queens. What's the
Yes.
best way people could reach you, Novi? You're on the website at cranialrelease.com to find a practitioner.
Yeah,
But do you have your own website, or?
I do. It's the ST for Simply Therapeutic. ST massages with an S.com. That's my website.
S like Sam, T like
Yeah.
Thomas, massages with an S at the end,
Yeah, .com.
.com. Okay. Beautiful, Novi. I appreciate your time. Thanks for helping us out, and we will be in touch, okay?
Thank you very much. Thank you for having me, Doc.
Thank
Appreciate
you,
it.
Novi.
Take care.
Have a good day.
You too.
Best to the wife and the kids for me, okay?
I'll do that. Thank you.
Goodbye.
Take
Thank
care.
you.
Bye-bye.